Now let's get political. It's Eric English with our two contenders. What's going on over there?
Thank you so much, Nick. Joe and Shane joining us again this morning. I know you guys have gone round and round about health care for several weeks now. And just recently, Senator John McCain held a town hall meeting in Arizona saying that Obama's health care plan is unaffordable. And I just want to see where you guys stand on that.
Sure. Obviously, the White House, during this nice little summer recess, we find out that they had underestimated the deficit for this, or for over the next 10 years, by $2 trillion, and by several hundred billion for this year alone. We're about to have a deficit in 2009 of $1.5 trillion. We had set a record before of $455 billion, and everybody, Democrat and Republican alike, were up in arms over that and taking President Bush and the Congress to task. We're in a $1.5 trillion hole right now. We cannot add to this if you just want to talk about it from a financial standpoint. The only way that we can is if you actually ration health care. It's the only way you can keep the cost down. And so when people say that we're not going to ration health care under a government system, they should actually be arguing for it. And that's all the more reason that we should oppose these sorts of things, because it's the only way that you can keep the controls.
Where do you stand?
I stand pretty much with the idea that healthcare as we have it right now is already too expensive. When you have a group of people, whether we can argue about whether it's 46 million people or 30 million people, we know there's a large part of the population who cannot afford healthcare. And we are essentially subsidizing those people through things like emergency services. And we want to get those things under control to where we now have those 30 million people buying into a system. I'd rather somebody pay $50 or $100 a month and not pay at all, and then have to go to the emergency room. And that way we're not actually concentrating on things like preventative care, where we can stop major issues from happening and things from developing into major problems, which are always going to cost more.
We can always focus on...
We put people out of business, we put people out of work because they're having to deal with medical costs, medical bills, or maybe they just physically can't go to work anymore because... and so we want to make a system that's going to be affordable for those people so that we keep our economy moving and keep people at work.
But you don't need to hold down 85% of the folks for 15% that don't have it. Preventative care is between me and my family and my health care provider. It's not for some government bureaucrat to mandate for how we're going to do our preventative care. That's a very important point. The thing that makes this country what it was, and that we can even have this discussion because we've got so much money collectively as a country, is the idea of liberty, the idea of risk, and the idea that you pay or reap the consequences of your actions. And so one of the things that we forget is that, yes, we need to take care of this 15% that are uninsured, but the rest of everybody else, 85% that already have insurance, do not need to lose their choice and don't need to lose their liberty in order to take care of that.
Right, and I agree, and there's nothing the president has said over and over again, and we see a lot of confusion coming up, but one of the main things that he said from the beginning is that we do not want to take away your choice, we do not want to take away your existing. I have private health care right now, and I plan to keep my private health care, but if there's a public option, it's something that it's literally another option.
Then you need to read Section 102 of H.R. 3200.
Well, let me ask you this, Joe. Yes or no? Do you think that this health care plan will add to the country's debt? Yes or no?
It's possible, but right now I think we're in a worse situation. Right, I think healthcare is always going to add to the debt because it's not a cost anybody wants to incur. It's a cost that we have to incur because people have healthcare needs.
Well, we only have a few seconds left, and I do want to get to Senator Ted Kennedy's debt. So tell me what you guys think about him and what he leaves behind.
Well, it's really ironic that we have this healthcare discussion right now. It's the biggest thing we're talking about in the country, and everybody looks at Ted Kennedy as kind of the icon of the healthcare issue in this country. And anytime you look at what are considered traditional liberal things like education, healthcare reform, and civil rights, you think of Ted Kennedy as the standard for those things. And so he will be missed by people all over the country. Even his political opponents, I think, have a great respect for him and see him as the end of an era of politics in America, for sure.
What's most memorable for you about Ted?
Probably the healthcare debates over the years, and then also the No Child Left Behind. When President Bush first came into office, Senator Kennedy worked very closely with President Bush. I mean, Senator Kennedy actually wrote the No Child Left Behind Act, that bill, and he has demonstrated some ability to work with a lot of different interests and a lot of different people over the years.
I'm glad we can end on something we all agree on. That's good. That's very good. All right, we'll have more on the life of late Senator Kennedy. Plus, James, we are standing by.